Just to introduce myself briefly, my name is Dr. Akil, or Bilal Akil. I'm an emergency physician at University of Western Ontario, Windsor Regional Hospital. I'm a trauma team leader of the
of
hospital
the
too.
hospital.
At the same time, I'm the emergency medicine um, academic director at Western Windsor campus. And I am the medical director of SkyCare Air Ambulance um, from Toronto, and the developer of MCCQbank. Sorry, it's a very busy screen. Ricardo is doing the management in the background. There's, I think, 10 people. Okay. So that's who I am. We developed MCCQbank mainly I'm an assistant professor at University of Western Ontario. So I do academic education at Western. So we developed this project for MCCQbank mainly. If you don't know it, we developed it a few years ago at University of Western with the University of Western graduates. And the purpose for that is to provide a Canadian resource to study for the MCCQ Bank and to support them with the OSCE. And the developer of this project are solely Canadian medical graduate from Western and McMaster University. So we developed all the curriculum hands-on. And it took us 3 years to validate all the questions and all the product and the material with keeping its ongoing validation and fixation of some of the questions to get the best out of it. So far, we launched this project to the IMG as of April 2025 last year, and this is kind of was a trial year for us to see how can we help the IMG community. The way we developed and validated the questions for MCCQ Bank is through Canadian medical students. So what we did, we provided the questions to the Canadian students, and we made them practice it for the exams, and we got the feedback from them. And most of the feedback were extremely positive, actually. And most of the feedback from IMGs for this kind of product were that the question are very close in similarity to the exam itself. Let me give me one second, Ricardo. Make me a host. Okay. I thought I did make you a host. Sorry, I'm just trying to figure out how to make Ricardo a host. Ricardo is our marketing director. He will be helping in the background. You are a host, Ricardo. Make host. Change host. Is a host now. Okay. So so what we did, we got this validated. Most of the questions, most of the feedback we got from IMGs that the questions are very similar to the exam itself. We actually did a challenge that we did anyone who use our product and does not pass the exam, they get their money back guaranteed 100%. So if you don't pass the exam, MCCQE1, you do all the questions and you do the crash course, and you don't pass the exam, you get your money back 100%. So far, we have not had that zero, not even one. Most of the people who reach out to us were thanking us on the high scores they received. We don't have many questions. So our question bank is only 1900 compared to other question bank are 3000 and whatever the case is. But again, it's not about quantity, it's about quality. We've been developing another 1500 questions for the past maybe 6 months right now. We have around 1200 they've been developed and currently ongoing validation. We were planning to launch them around the end of December 2025, but we decided not to do that to continue the validation. So hopefully soon we will do that. The second part of the MCCQ Bank is actually the crash course, which is a summary of the Toronto Note. The Toronto Note is your guidelines and your, I don't know if you want to use Bible as a method of an example for the exam itself. So Toronto Note is the extremely important reference book to have at home, but you do not need the entire Toronto Note for this exam specifically. It's very hectic, it's very large, it's like a Harrison book of medicine. So what we did, we summarized the information that's actually relevant to the objectives of the exam, and we made them in a PowerPoint format to study on your own at your own guidance. So it's a crash course that you need as a reference that you will study on your own without guidance from a physician or a student or resident. It's more than enough to cover all the high yield points and must know for the crash course. Then the second part of this, and then we'll go of what how you need to study and what to study. So I'll take another 3 minutes, and then we'll go to the second part of this webinar. I might be speaking fast. Emerging physicians tend to speak fast because we deal with high volumes. But I'm happy to, if you take notes and you have questions, please send me a message or send an email, and we promise to respond to you within 24 hours. The second part of this, what we developed something called OSCE, which is OSCE review. And this OSCE review is the first part, which is what we did right now, is just physical exam and history taking in order. So I'm previous examiner for NAC-OSCE. So I was up to 2023. I was an examiner for NAC-OSCE with MCCQE1 or Medical Council of Canada. And since then, I stopped because of conflict of interest, obviously. So the way we developed it based on the rubric of grading. So what we focus on as an examiner for NAC-OSCE is your flow, your communication skills, your professionalism, and your approach your patient. So one of the things, for example, people ask me, how do I do that in NAC-OSCE? So as an examiner, I'm observing you, I'm looking at you doing the exam. I don't actually really care how much, where you're putting your stethoscope on the chest. What I care is what you're telling me you're listening to on the stethoscope. So the verbalization of the physical exam is the single most important aspect of your exam. If you verbalize what you're doing, and I, as an examiner, I perceive that you understand what you're doing, you got the point. And most common issue I found most examiners, most examinee or student struggle with is their flow. When they start doing the flow, they struggle. When they do, they jumble all over the place. They forget to wash their hand. They forget to introduce themselves. They forget to drape the patient. Those are easy points to have. And they start doing the exam. They start with the chest. They forget the heart, and they go back and forth. Or some of them, they do the exam appropriately, physical exam, but they don't tell me what they're listening to. So I actually can't give them pertinent positive or pertinent negative at the same time. I don't know what they're doing. They're acting for me, so they don't get the point for that. So what we did, the OSCE, the way we did it is very simple algorithm, not algorithm, like a flow of the examination of the history and physical, starting and repetitively in every slide you open, you will see start by washing your hand, introducing yourself, because they are easy points. And if you don't do them, you lose the point. It's simple as that. 75% of your NAC-OSCE is actually between presentation, communication, professionalism, draping the patient, simple one, going all the way into the flow and organizing your physical exam and history taking. So what we did, we created this OSCE based on that. That's a simple process. And the reason we did it this way, to cover all the organ system and to actually make you memorize the flow of the exam simply, so repetitively. And you can practice it anytime with anybody you want, with your friend, with your partner, your son, whoever you want. And then repetition, 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 repetition. And by getting that repetition becomes the smooth flow of the exam. That's the hard part. Once you get that mastered, you 25 to 30% of the exam is diagnostics, management, and counseling. The second part of the OSCE, which is being developed right now, we're actually developing a full crash course OSCE, start from knocking on the door to the 2-minute reading of the case, to the 3-minute, to the 7-minute encounter, to the 3-minute at the end of the session, which is differential diagnosis and management. That's being developed at this moment and will be launched hopefully very soon, within a couple of weeks. If you have access to the app, you have the rest of the access to the OSCE for free. So it will be fully developed crash course for the OSCE, including case scenarios that to expect. We'll have like tons of it. So what's new about NAC-OSCE? What's the most important to know? Back up to end of 2025 or mid of 2025, there used to be history only stations, physical only stations, and counseling only stations. So now it's the change are the following: 20 to 30% will be only history station. Sorry, I don't count me out the percentage. I don't remember now. I'm mixing them up. But part of the exam, out of the 12 station, part of it will be history only. And when they tell you history, you do not touch the patient, no physical exam. The second part will be history and physical, no more physical only. Sorry, I'm in the hospital, so you'll be hearing lots of overheads. So the second part will be history and physical only. So when you do history physical, you start with focused history to the chief complaint, then physical part of that, the second part of the exam. And the third aspect of the OSCE, give me one second. The second part of the OSCE or NAC-OSCE will be the third part, which is the counseling. You'll have counseling station. And counseling station are usually, for example, sexual assault, gynecology, OB, mental health. Uh, Cases where I'm going to give you an example. Actually, recent cases where one of a few of my students encountered, for example, like a pneumothorax. Okay. A vaginal bleed, those are counseling case, oral contraception management, depression and anxiety. Obviously, we can go for on and on and on, but all these cases that I'm discussing and that I experienced with my students will be in the crash course itself very soon. So far, the Oscar itself, now it's just physical and history examination. I'm going to slow down now. We're at 14 minutes. So the next 15 minutes, I will be talking about how to prepare. I'm going to tell you one thing, and I promise you this is very correct. The single most important factor that predicts your matching in Canada for CaRMS is your score through MCCQE1 and NAC-OSCE. That's the single most important predictor. So if you do well with your NAC-OSCE and your OSCE, sorry, give me one second. Okay. So the your score is the single most important. So you cannot mess it up. There's two tricks here. MCCQ1, it's a pass, and that's it. You're good to go. Hopefully you get good score. You cannot go back and redo it. If you fail, that's okay. You can fail up to 4 times. Nobody cares. Uh, Nobody cares about your scores. Your previous, sorry, if you failed 3 times and you pass it the fourth time, nobody's going to ask you actually or even know. But if you pass it with low score, you're a bit in trouble. The second part, the NAC-OSCE actually you can do it up to 3 times if I'm not mistaken. And the 3 times, if you don't like your score on the first time, you can repeat it the second time. If you don't like it the second time, you can repeat it the third time, and nobody cares about your previous scores. Then there is other aspect of the your English proficiency. I don't know. There's some exams, or you can do certification or something like that. There's Casper, which is minor and it's not required on all exams. That's the first part, which is extremely important. So then they tell me, okay, how high should be the score? It depends on the program. So the questions, uh, so sorry, give me one second. All the questions will be taken sometime. So I will try to make 5 minutes for the question toward the end. Um, so most of the students struggle to how do I prepare? Listen, if you don't have guidance through your preparation, you're in trouble. And if you don't have trustworthy guidance, you're in trouble too. You can study on your own as much as you want. That's good. Maybe do a partnership type of study and connect with someone that actually you can trust. We do provide actually mentorship. If you actually, for example, let's say you buy the package. We have a package. You do OSCE, Oscar, crash course, and the questions, the question bank, like a bundle plan. You actually have the full hour with me live on study plan or even cause preparation or one of my physicians or resident guidance. So how do I study? If you don't give yourself minimum 6 months for this exam, for both exams, minimum, when I say minimum, 3 and 3 for 3 months for each exam, that's not enough. So when I say minimum, could be 3 to 6 months per exam. And when you do the 3 month, let's say you did be done. There's no way. If you skip it, you're gambling. Is doing something called MCC.ca practice questions. So MCC.ca, they have fancy practice questions of retired questions from before that are very expensive, $500 plus, whatever the case is, but they must be done, all of them. And please do not use them as a practice. Do them as testing yourself. If you do well with those questions, then proceed with your examination. If you do not do well, do not proceed on the examination and you postpone your exam. That's for the MCCQE1. Everything is recorded, by the way, and you will be sent a copy of this video for your own review with a small slider of one pager of kind of bullet point format summary. Then you tell me what resources should I use. I'm going to be very honest with you. Every one of you should have a hand copy of Toronto Note as a reference book. You cannot study MCCQ, sorry, you cannot study you cannot study the entire book because it's hefty. The book is like Harrison of medicine, good for plastic surgery, orthopedic surgery, dermatology, emergency medicine, family medicine, and so forth. But for the exam, part of the book is good for the exam. That's why we summarized it in our crash course. You have to do at least one or two full question banks. So you can do, for example, our question bank, MCCQE1, if you MCCQbank, if you like to. And again, MCCQbank, it's an application through Android, application through iOS, and it's a website. So you can download on your phone, study on the go. You can do it on your own laptop, and it's a full functional application with the only actually unique question or a preparatory material that actually have a fully functional application. And plus that, you still have to do the MCC.CA questions, all of them, and do not use them to study. Our actually application, if you're asking for the price, if you download it right now, you can see actually go to the combination plan. You can see it starts from $90 all the way to $400. The entire package, everything, including the crash course, the OSCE, the question bank. So once you're done that and you're scoring one standard deviation above mean. So for example, let's say you're doing MCCQ Bank. Our average is around maybe 68 to 70%, which correlates with the average in Canada overall. Some students who reach out to me after doing the question, they were doing scoring around 85%, 85%. If you're scoring 85% in our question bank, you're golden. So one standard deviation above mean, that should be your minimum standard. If you're scoring average, you might want to push yourself a little further. Uh, that's for the MCCQ. So you study for 3 months and you test yourself with the MCC.ca. You do the crash course while you're doing the question bank and you test your knowledge. One thing about the crash course we're doing, which is we're improving for the next couple of weeks, if you're examining in September or August, is while you're doing the slides, it's PowerPoint format only. Every fifth or sixth slide, you have test your knowledge. You'll press on a button, it gives you a bunch of questions to test your knowledge based on the previous slides. Plus, you have actually flashcards to test your knowledge accordingly. So let's say you finish that over 6 months. How much percentage we aim for MCC practice test? I'll try to answer all those questions. And if I don't answer them in this because I'm actually in the ED, I will send them an email as an answer to everyone. Um, so when it goes to NAC-OSCE, let's say you have to finish MCCQ1 first and then do NAC-OSCE after. And the reason you do that because you strengthen your medical knowledge for diagnostic and management purpose. Remember, and NAC-OSCE, 30% of the exam is medical knowledge, pathophysiology, diagnostics, differential, and management. The 75% is practical, like physical exam, history taking, professionalism, communication, and organization. So let's say you did the MCCQ1, you scored well, and you're happy. You start studying your NAC-OSCE. NAC-OSCE is all about practice, 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 practice. It's 12 stations. You knock on a door, you read the stem, 2 minutes. Very simple stem. 75-year-old gentleman with shortness of breath for the past week. Please perform physical and history. You go in, you have 8 minutes. You do the history, focus history on cardiovascular, cardio rest. You do focused physical exam on cardio rest. And after the 8 minutes are done, you have 3 minutes. You do your differential diagnosis is pneumonia, pneumothorax, I don't know, lung cancer, heart attack. Then the management and investigation. I need chest X-ray, I need an EKG, I need troponin, CBC, VBG, and so forth. How do you master that? You really have to, it's very nerve-wracking. It's very, very stressful exam. People will be sweating bullets in that exam. I've seen it firsthand. Even at the university when I'm teaching, the top student, they still very nervous. When you're not very confident and you're not flowing the exam very smoothly, you become nervous. And once you become nervous, you do mistakes. So what I would recommend to do is maybe let's say you download our application in this original format right now with the still ongoing growth. You practice with your partner. Just keep repeating the same flow. I'm doing shoulder exam, for example. Just repeating the flow. Repeat again and again and again. And you have to do it blindly while closing your eyes. The same organized flow. And the trick about being organized about the NAC-OSCE, if you do it well organized, the examiner will be able to follow you smoothly and not miss certain things that you said. If you're unorganized, they will think you didn't say it. Because what happens if I'm flipping back and forth, I'm correcting your exam, I might miss. I don't know where he is. Oh, did he say that? Oh, I didn't. I don't remember. But if you do it smoothly, I'm actually following your rubric and correcting you smoothly. So that's the first step: repetition, 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 repetition. Once you're done all your repetition, what I would do is maybe meet with a colleague that's who actually doing the exam themselves and doing in a real exam setting where you time yourself. Our actually application that Oscar in a couple of weeks from today will have actually full exam setting mode where you actually start the mode. It gives you 2 minutes to read the stem, then 8 minutes to do the exam, and 3 minutes to do the encounter. And you talk to the application, and the application will correct, you type what your differential diagnosis is, you type your management, and the application will tell you what you did right and what you need to improve. So again, in order to really master this exam, you really have to practice, practice, practice. And the practice of minimum 3 months in order to master all aspects. One of the difficult aspects of NAC-OSCE is actually counseling. And the so oral contraception, sexual assault, mental health, depression, anxiety, panic attack symptoms, STIs, anything related to things that gynecology, obstetric, anything that you can actually not, or cancer screening, anything that you cannot physically examine and you will not be examined. So you will not be examining peds. There's no peds. There will be no physical examination to pediatric, no physical examination to gynecology, no physical examination to obstetric, no breast exams, no, obviously, mental health, there's nothing like an STI, no. Anything related to GU system and private organs, they will not be exposed. And they have to be protected and covered through draping. Other aspect to matching CaRMS are things that I do not cover. So I do not cover language. I do not cover, like, for example, Casper, but those are minor aspect of that CaRMS process. So this a brief introduction. We will be doing more of those webinars. We will be downloading this into our YouTube page. You can read it. The most important to know, one of the update about NAC-OSCE, there's no pure physical examination only. It will be focused physical examination. Focused physical examination with focused history first, and then at the end toward the exam. So no more pure physical only. This application, it's ongoing improvement. We have improved it significantly since we started. There's two aspects of the improvement going this month. One of them is uploading the 1200 question, hopefully by the end of this month. The second part will be improving the Oscar to be full NAC-OSCE crash course where you can actually test yourself, knock on the door, time yourself, and do the process. The third part is the actually MCCQE1 crash course. It is right now in the full format, updated as of July 2025. Full format and the latest version of Toronto Notes. It's very affordable. It's cheaper than the book itself, cheaper than any crash course in the market. I don't know if you need those in the market to be 3 weeks, because it's not about the knowledge. It's about testing yourself and practicing more and more and more. By the end of that, if you again, plus if you end up getting the package entirely, you actually are eligible for a free 1 full hour with myself or one of my physician colleagues, partners, or a resident who matched recently, and we can go over a plan. MCCQbank on the Apple Store. Yes, it is on Apple and Android. So I'm gonna stop here. I'm gonna go over those questions really quick and see how much I can answer. Sorry, it is a really short webinar, but I know as an examinee or a candidate for CaRMS, the entire time in the world wouldn't be enough for you. But at least we're giving you those opportunities to talk to someone who's actually a physician involved in the process, um, and teach this product to Canadian medical graduates. I'm trying to figure out where the message is. Oh, I think because no, I can see them. Okay. And then you can meet with me or send an email. So if you have further questions, please send them in a bullet point format, brief questions to marketing@mccQbank.com. Ricardo will be uploading the link and will answer all your questions as much as possible. That's one. Two, at the end of this webinar, in 2 minutes, Ricardo will be putting a a promotion code. If you download the application and you purchase with that promotion code, you get 25% off. So let's say that if you buy the entire package for 6 months, it's $400, will become like less than, I don't know, 350 or something. Um, Score-wise, there's no really score. So the score is depends on the program. If you want to know the score you're aiming for, which is some of them are available, go to CaRMS.ca, go to the program specific, open that page, and they will tell you if there's score requirement. But you really have to be one standard deviation above mean. Look up last mean of last year, and you will be one standard deviation above that. Yes, the full plan. There's plan for us only question bank. There's plan for question bank and crash course, and there's plan for question bank, crash course, and OSCE. The on the price I don't remember it. So how much percentage should we aim MCCQbank? So that's difficult question to answer. So again, there's no high enough. There's no high enough. But if you're average or below, I don't think anybody knows that answer, to be honest with you. And I don't think anybody should know that answer. But if you're average, when I say average, 60 to 70, 67% or below, you're in a bit of trouble. If you're 75 and above, you're in good shape. Are there? No. So the question banks are not AI generated. None of them are human made one by one. Even though there's nothing wrong with AI these days, but AI is not accurate. Any procedural mannequin? No. So no procedures. No mannequins. There's only standard, like a human who acts as a patient. Yes, the application is downloadable. Yes, if you buy both, you are eligible for 1 full hour. With could be with myself, could be with my colleague, whoever's available, anytime you wish within the period you have it. And that hour could be tailored for the study plan, or could be tailored for testing yourself. If you want to meet with me to test your knowledge, I'm happy to do that for an hour. Or if you want to do CARMS preparation or application or review of your app, I do that a lot. We actually sometimes even help some of the candidates to do mentorship, or no, not mentorship, observership in our emergency department to give you a letter of recommendation if you need that. So the Ricardo's uploaded webinar 25 for 25%. So yes, the updates on the question, the 1200 question will be updated. So the questions are updated as of July 2025. And there will be, again, the rest of the question are being validated currently. So NAC-OSCE score, there's no they keep changing the scoring system. It used to be in the 100 digits, so up to 100. Now it's in the 400s. Again, the score is based on program dependent. Nobody would know exactly how the MCC.ca scores, but you have to be in the top 5 percentile. Yes, the code is webinar 2025. How much percent? You're very welcome. I can't see the code, promo code. Valid only for a month. So the promo code is valid only for a month. What format ask course session weekly? No, we don't have a crash course with a human. You can meet with me for an hour, but the crash course is made to study on your own at your own pace. No, we don't charge for observation. It's free. So yes, we do observation if you need a letter of recommendation if you're one of our students. If this is this the only email where I can ask course as well as a booking? Yes, so marketing at mccQbank.com.
I know, I
So
was
I had
reading
students
around.
who passed the exam. I had the sorry, give me 1 second. So I had students who did very well in their exam, but they were lacking one letter of recommendation from Canada. We were happy to actually observe them and give them a letter accordingly based on their performance, obviously. And it's usually honest letter. Nothing is made up. No fraudulent activity here. Okay, so I'm gonna end this, and it was nice meeting everyone, and good luck. And we will be doing another webinar in 6 to 8 weeks from today to go over more details. And this is, I'll leave it to Ricardo. I'm gonna be logging out. take a picture of this just to keep it for the future. And again, you can review all the recording on our YouTube channel. If you go to YouTube, so it's MCCQbank YouTube channel, and you can rewatch this webinar. And we will be emailing you a copy of the video with a small brief of all the discussion. Good luck.
So, hey everyone, I hope you all are well. So, in case that if any of the question is not answered, so I would request you to please email it at marketing@mccqbank.com. What I'm going to do is I'm going to type it into the chat box. It is just a second. So, yeah, it is marketing, marketing, @mccqbank.com, mccqbank.com. And no worries, everything will be shared to you via email, all the pictures about the platform, about this recording, and the summary of this webinar, and the YouTube recording of that you're asking. I'm gonna be giving you into the email. So that's it for today. Thanks a lot for attending.